Hi everyone, I will share about case study presentation for detection of thyroid disorders using nuclear imaging. First we go to introduction. Thyroid disorders change how the body uses energy and cause health problems if not found early. Since their symptoms are like other diseases, it is sometimes hard to diagnose. Tests such as radioactive iodine uptake and thyroid scans help doctors clearly see thyroid function. This test help detect problems early and guide proper treatment. Then we go to objectives. The main goal of this objectives is to check how useful radioactive iodine uptake tests are in finding thyroid problems. It also shows how gamma camera imaging helps locate thyroid nodules and study their activity. This compares imaging results with blood test for better accuracy and highlights the importance of nuclear imaging in planning treatment. Then we go to patient evaluation. Patients showing signs like weight change, neck swelling, or tiredness were chosen for the study. Abnormal thyroid hormone level in blood tests were also considered. These patients had nuclear imaging test to check how their thyroid was working and to find any problems in its structure. Then we go to data analysis. The collected imaging results were compared with blood test and ultrasound scans to confirm accuracy. The study checked how these findings matched to see which method worked best. Patterns of thyroid iodine uptake were also studied to understand different thyroid diseases such as hyperthyroidism, hypothyroidism, and thyroid node.
Already we know the deductions of thyroid disorders using nuclear imaging. We have two tests. First one is radioactive iodine uptake test and gamma camera imaging. Radioactive iodine test uptake test means a small amount of radioactive iodine given to the patients. It have a specific time interval measured between the 2 to 6 hours and 24 hours. In the result, help differentiate between the hypothyroidism and hyperthyroidism, thyroiditis. Second one is gamma camera. The gamma camera capture the image, thyroid uptake and distributions. A hot nodules means high amount of thyroid uptake and cold nodules means a low amount of iodine uptakes were identified in this test. The differentiate between the benign from the malignant cancerous and non-cancerous treatment in the thyroid test. Finally, evaluations and patients outcome means it has a patients monitoring in the real-time analysis and thyroid reduction yearly assessment. And finally, the deductions of thyroid disorders using nuclear imaging means first patients evaluations and radioactive thyroid uptake test and gamma camera imaging. Finally we go to the diagnosis. Thank you.